A lot of people like to lump all the hepatitis diseases together, A, B, and C. But it just so happens that B and C have special properties in that they can cause long-term problems in the liver, and that's why there's such a concern. My research has actually shown that most of those long-term problems that happen are demonstrated in third world countries, where nutrition actually is one of the factors that contributes to that long-term problem, as well as being infected early in life, which is more likely in those impoverished countries. So hepatitis B and C can cause chronic liver disease and can lead to cancer of the liver. So hepatitis A virus, however, which comes from this picornavirus family as well, does not have a chronic carrier state. It does not have a chronic active state. It does not lead to cancer of the liver. Hepatitis A is a disease of children that is asymptomatic in something like 90% of them, that they don't even know that they've had a disease, as opposed to adults where you're more likely to have symptoms. Some 15% of people infected can develop symptoms of jaundice. That's where the bilirubin builds up in the body and can turn the skin to, funny yellowish. Of course, there's no study looking at, what happens if vitamin C is given immediately after somebody is diagnosed with hepatitis. But there is some evidence in the medical literature that even with hepatitis B, that vitamin C does have a beneficial effect. So I would also have to wonder if we could ameliorate some of the deeper problems with the infection if adequate vitamin C was being used. Unfortunately, a lot of the statistics that you'll find in terms of what the death rates are come from impoverished countries where the disease is high because of poor sanitation and where immune systems aren't functioning the best because of nutrition and overcrowding or war and things like that. Let me just read you some comments from the CDC. How serious is hepatitis A? This is a direct quote from the CDC website. Almost all people who get hepatitis A recover completely and do not have any lasting liver damage, although they may feel sick for months. Hepatitis A can sometimes cause liver failure and death, although this is rare and occurs more commonly in persons 50 years of age or older and in persons with other liver disease such as hepatitis B and C. Now, I did a little bit of reading on the California outbreak last night, and what I could determine is that the majority, or at least the focus, is in San Diego. Now, I've been to San Diego, and I'll tell you something I was really blown away by is the homeless rate in San Diego. The homeless people are everywhere. They're living under horrible conditions, lots of psychological illness. Their skin doesn't look healthy. They're puffy, they're red, they're looking improperly nourished, high rates of alcoholism, living on the street without adequate access to water and sanitation. These are all high risk factors for having not just contracting hepatitis A because your immune system might not be able to brush it off like a healthy immune system, but to having a more severe outcome. So why on earth are we scaring the general public and saying that they're going to catch a disease that could kill them and that they can prevent it with the vaccine? I think it doesn't make any sense at all.